Welcome, dear students and friends. Welcome to Family Tutorials. Today we're going to understand a disease condition known as rheumatoid arthritis. Now, before we really understand what rheumatoid arthritis means, what is the pathogenesis and clinical presentation, starting with what we mean by rheumatoid arthritis word. First, we focus on the word that is arthritis. If we split the word arthritis, we are having two words, arthus and itis. Arthus and itis. Arthus stands for joints and itis is standing for inflammation. So basically this condition is inflammation of the joints. Arthritis means inflammation of the joints. Now why we are putting the word rheumatoid ahead? Rheumatoid comes from the word that is known as rheumatism. Rheumatism, that is the condition in which there would be an inflammation and pain in especially in muscles, fibrous tissues, joints and some of the connective tissues too. And that type of the condition is mainly arising due to autoimmunity. And that is why this entire condition is known as what? Rheumatoid arthritis. Because in this condition also the joints inflammation is occurring through triggerance of autoimmunity. Now, before we really understand the definition and other aspects, first it is very important to know which disease category this disease belongs to and why it belongs to this particular disease category. So very obviously it belongs to the disease category known as autoimmune disease conditions. Why? Because autoimmune disease conditions are the conditions in which our immunity, our body's immunity is targeting our own tissue, and in this particular case also whatever the autoantibodies are getting generated, they are targeting our own joints and surrounding muscles and further different areas too, and that is why it is known as autoimmune disease condition. Now, so we can say that autoimmunity or autoimmune disease condition, that is the nature of this particular disease. Now, after occurrence of this rheumatoid arthritis, where are the areas where it is getting targeting? So the areas are mainly the patient is having pain in the upper limbs and multiple joints and muscles. So the major targeted areas are muscles and bones, skeletal. So that is why this disease condition is also categorized under the disease category that is musculo-skeletal disease condition, as different joints, muscles and even bones are getting affected. How bones are getting affected, that will understand in the pathophysiology part. Coming to the very important portion, that is definition. First I read the definition. RA, that is the abbreviation of rheumatoid arthritis. RA is a chronic and usually progressive inflammatory disorder of a non-etiology characterized by polyarticular, symmetric joint involvement and systemic manifestations. We understand one by one the important points. Rheumatoid arthritis is a chronic disease condition. Why chronic? Unlike other disease condition, or we can say infections like malaria, typhoid, they are just for few days or even for just few months. Okay, so they are the acute condition. Unlike this disease condition remains for years and years, and most of the time rheumatoid arthritis is lifelong. The patient has to take the medication until he or she dies, and that is why it is known as chronic disease condition. And usually it is progressive inflammatory disorder. Very important. Initially, whenever the patient is being diagnosed or getting affected with the rheumatoid arthritis, the patient is having very mild to moderate type of the pain in the joints and muscles, but gradually it getting increased, and at very later stage it can be very severe, and that is why it is known as progressive. The signs and symptoms and even the complications are getting worsened day by day. Progressive inflammatory disorder. Why disorder? Because in a later phases the patient is having multiple complications, I can say multiple signs and symptoms, even the multiple systems is getting affected. That is why it is progressive inflammatory disorder of a non-etiology. Very important. We have understood that the nature of this particular disease condition, that is autoimmune, that is the nature of this particular disease, that is not the cause of the disease condition. How autoimmunity is getting triggered, how autoantibodies are getting generated, those are not known. Those mechanism or the hypothesis are not exactly known, and that is why it is having unknown etiology, unknown causes, which is being characterized by very important. Dear students, don't forget this particular line: polyarticular symmetric joint involvement. This is the classical feature of the rheumatoid arthritis. What is the first word? Polyarticular. We know articular system, that is the joint system, and here in the case of rheumatoid arthritis, at least 4 to 5, not less than that, more than 4 to 5 joints are getting involved, and that is why we are writing the word polyarticular, many joint involvement. How they are getting exactly involved? Suppose I have a pain and inflammation in my right wrist, so similar kind of the pain and inflammatory pattern will be observed in the left limb too, and that is why there is some symmetry in the involvement of the joints in both the halves, and that is why it is known as what? Having symmetric joint involvement. And in a later phase, it is not just restricts up to the joint and muscles, it will further target this autoantibodies which are generated in the case of rheumatoid arthritis, will further target our lung, kidney, even the heart and other organ system. So we can say there would be the systemic involvement. Systemic complications are getting developed, and ultimately a patient might have multiple organ system involvement, or we can say systemic manifestations. Okay, so this underlined word are very important. Once again we revise, it is chronic disease condition, it is for years and years, and most of the time lifelong. It is progressive inflammatory disorder. The signs and symptoms are getting worsened or are getting more severe. Unknown etiology, how the autoimmunity is getting triggered are not exactly known, those mechanisms. Polyarticular, more than 4 to 5 joints are getting involved in entire body, and symmetrical joint involvement, and ultimately we are having multiple organ system involvement, so we are writing the systemic manifestations. If you are able to remember these words in proper sequence, you can write the definition in very easy manner. Then third point we're going to understand, that is epidemiology. Okay, so first thing, that is it is a less prevalent. If we see the entire prevalence worldwide, it is not that much a very common disease condition like that of the hypertension, diabetes or other cardiac conditions. It is not that much prevalence, and prevalence is about 1 to 2% overall. Coming to the age, it can occur at any age, but in children and young individual it is not so common. Yeah, in adult it may occur, but most affected age group, that is 61 to 70 years of the age. So we can say that in the 7th decade of the life, or we can easily say that in the older or elderly individuals, this rheumatoid arthritis disease condition is very common. It is 3 times more common in female population, in women. Why? Remember, dear students, remember one very common fact, that autoimmune disease conditions are very common in female population. Here we may have another example of another autoimmune disease condition, that is SLE. Please note down SLE. SLE stands for systemic lupus erythematosus. Systemic lupus erythematosus. It is also an autoimmune disease condition which is targeting the lupus. Lupus stands for cutaneous tissue, resulting into the inflammation of the cutaneous tissue. Means erythema, it results in the redness of the cutaneous tissue. So we are writing lupus erythematosus. And further, it may target your lung, kidney, liver, heart and other organ system too. And that is why it is known as systemic lupus erythematosus, SLE condition. That is also very prevalent in female population. So we can say that autoimmune disease condition are many more time prevalent in female compared to that of the male population. There are some mechanisms and hypotheses that relates to emotional status and hormonal status of the female population. And remember, of course, later on in pathophysiology we'll definitely discuss, but few of the inflammatory markers, those are interleukin 1 and interleukin 6. We are commonly writing as IL-1 and IL-6. They are very commonly generate in female population, interleukin 1 and 6, and those are mainly responsible for occurrence of autoimmune disease condition like rheumatoid arthritis. So it is 3 times more common in female population compared to male. Now, very important, whenever we talk about autoimmune disease condition, most of the time we are talking about HLA. HLA stands for human leukocyte antigen. This antigen are present over the leukocytes. Especially we are talking about the T lymphocytes. Over the T lymphocytes, this HLA are present. But whenever there is some minor changes occurs in the HLA morphology, so it will be having a different form. I once again repeat, whenever there is some minor changes in the HLA which are present on the leukocyte WBC of the human beings, they will behave in a different manner, and at that time they can trigger autoimmunity. I mean, at that time those HLA are responsible for generating autoantibodies which are targeting our own body tissues, and that can result into autoimmune disease condition. So here in this case, the particular type of the HLA, I can say the mutated HLA, or I can say HLA allele, a different type of the HLA allele, that is HLA-DR4. So whenever a person is having a presence of HLA-DR4, that particular individual is 3.5 times more likely, more prone for the occurrence, development of rheumatoid arthritis condition. Okay, and last thing is 6 times more common in children whose parents are having RA factor positive. If the parents are having rheumatoid arthritis factor positive, rheumatoid arthritis autoantibodies, then their children, especially monozygotic and dizygotic twins, are having more risk for the development of occurrence of the rheumatoid arthritis. Now understand, it may happen in a later phase of the life rather than in early childhood. Good. So that is all about the epidemiology. And last we gonna discuss is about the infectious risk factors. Why I have written infectious risk factors rather than writing infectious etiology. We have already understood that it is an autoimmune disease condition which is having a known etiology. The causes are not exactly known or exactly proven. So some of the risk factors are there, and those risk factors, if occurs in risk factors are present, then that particular individual are more prone, more vulnerable for development of this particular disease condition. So few of the infections we have written here. So that is infectious risk factors, that is the mycoplasma infection commonly causing the pneumonia, then Epstein-Barr virus infection, parvovirus infection, cytomegalovirus infection, and rubella virus infection. So if a person is having these infections very commonly, very frequently, recurrent infections of this category, then a person is having some chance to develop autoimmunity, and that triggered autoimmunity may cause rheumatoid arthritis. So this is just a risk factor and one kind of the hypothesis. So in this patient we can take a much care for the prevention. We can't say the prevention, we can take much care to decrease the chance of this particular infections. This is all about the basics. This is all about the basics of the rheumatoid arthritis. In next lecture we understand the pathophysiology and clinical complications. Thank you.